Si unfair because every time nikikwambia kitu nakatanga kunisikiza. That is not right. Every time I tell you to do something, you usually don't do it. Do I have to keep repeating myself over and over again? No, it has to be.
Tunapenda tu arguments to petty sana tu kidogo.
Hapana, no, that is not petty.
No, honestly,
that is something
you like you like to argue kitu hata it makes sense.
So kitu yenye mimi nakwambia it makes sense.
No, I'm not saying it doesn't make sense. I'm just saying you like picking petty things and making them seem like you make a mountain out of a small.
What do you mean I make a mountain? So Kemo, I started to tell you kutoka sijui 2 weeks ago. 2 weeks ago Kemo, kitu nilikwambia 2 weeks ago hadi sasa.
Sasa hiyo ni kitu unaleta saa hii mbele ya kamera.
Lazima nilete because you cannot be.
Unapenda kuleta drama mali hata it makes sense. To shoot.
Mimi naenda kuona therapist. Twende.
No, tufanye intro kwanza.
Mimi sitaki kufanya intro, mimi nataka kwenda kuona therapist.
Kila kitu itakuwa ni therapy. Hapana. Kila kitu itakuwa therapy.
Kila kitu itakuwa ni therapy. Hata ukinifanyia hivi, hata ukinifanyia kitu kidogo
therapy.
I want my mental state to be okay.
I'm asking a question. Kila time ni therapy.
Mimi nataka mental state.
Tukadogo, lazima tutaenda kuona therapist tumuulize hiyo. Lazima tutaenda therapy tumwambie hiyo. Lazima nitaambia therapist.
Lazima niambie. Everything. I want my mental status to be okay. We are fighting depression out here. I don't want to be depressed and I don't want stress. Lazima nikuambie na lazima nijue.
Hi Richie. How are you? Hi Kemo.
Hi Trizah.
Hi Richie.
Richie, come. To say hi. I don't know.
Richie, we don't do it this way, please. How are you?
I'm not good.
Oh, it's okay. Have a seat. It's okay. Good to have you people. Seems today is not one of our good days, but here we are.
Yeah, so shida ni kila time amfura tu kama ndazi kitu kidogo therapy.
No, it's okay. Richie, do you need?
I need therapy.
No,
that's what I need.
Okay. Do you need time? Would you like Kemo to give us some space?
Leave me alone, yes.
Not you and me.
Yes.
Kemo.
Yes.
No, do you have something to share?
No, she has a lot to share. It seems like she's the one who has things to share. So
you see, all the time it's I'm the one. Why is it that I'm the one always, all the time?
Let's start. How are the babies?
Wako sawa.
How are they?
You see the attitude now she's giving.
No, it's still okay. How are they?
The kids are okay. Everyone is fine. Apart from her, so.
And yes guys, I know you're wondering tuko wapi. Tumetoka kukuwapatia story mingi. So thank you guys for joining us, and this is Allsmiles Therapy Center. Kemo.
Yeah, mazi. Allsmiles Therapy Center. And asante sana Trizah. We really appreciate. Yani ulitusaidia sana ever since we started this journey with you.
Yeah.
Coming for therapies and what have you. It's been amazing. So tumeamua turudi tuonesha watu what exactly happens in a therapy center. Because watu wengi wanauliza gani therapy center, kwani lazima ukue umefika pale you don't wait until you're falling apart. That's when you're coming for therapy. And that's the reason we're here, to just continue with a good journey that we had started with Allsmiles Therapy Center, guys. And it's been amazing.
It's been amazing. And yes guys, let me tell you, the first time we posted a video saying ati tumeenda therapy, the questions that we had, Rach, kwani what's happening? Are you guys okay? Do you need to talk to someone? Okay, we are just from saying we are just from saying we are from therapy, and someone is asking us, do you want to talk to someone?
Are you guys okay? I think the major question was, are you guys okay?
Yeah, that was
Ile question ilikuwa ina
Yes, hiyo ndio yeah. But guys, let me tell you something. You don't have to be okay. No, you don't have to be not okay, right?
You don't have to be not okay.
Not okay for you to go for therapy. And that's why, ladies and gentlemen, we want to introduce to you an amazing therapist who has worked with us throughout this journey. Ametusaidia by the way, mkitaka kujua masiri zetu zote mingi, that is mingi. We are so glad to host our therapist.
Yes.
And now, ladies and gentlemen, introducing to you one of the most amazing therapists in the 254, the one who will walk with you this journey. Yani hata kama wewe una feel kiatu inakufinya, wewe ingia tu mwambie kiatu itakufinya.
But then, I think when it comes to therapy sessions, correct me if I'm wrong, yeah? It's more, but she will tell us, right?
Yeah.
It's more of like trying to listen, paying, like giving an ear to someone who is hurting from the heart.
Yes.
So maybe I'm wrong, maybe kitu inaniumiza roho yangu ni kiatu kunifinya, and I don't know what to do about it because hazi yangu ananiambia lazima nivae.
Yes. Guys, the right person to come to is Trizah. Mpige makofi. Trizah, karibu
You are
sana.
amazing people. Thank you.
Karibu
Thank you so
sana,
much.
Allsmiles Therapy.
Thank you.
Yeah, we are happy to be. We are welcoming you at Allsmiles Therapy.
Thank you, and I so much feel at home.
Yeah.
Yeah.
We are so
Thank you.
happy.
First is to appreciate you people.
Yeah.
For voluntary, sharing your experience out there with people.
Yes.
And I still remember the very first time we did this. I kept on asking, are you sure this is what you really want?
Yes.
We go,
Yeah.
But actually, I think it was more of me, Yeah, but when you said, yes, it's okay, let's get to share with other people out there. And I can tell you for sure, so many people, they've been coming since, 2022,
Wow.
Pick and Arrange, have seen everything that you've shared. You've walked a journey with them.
Yes.
And you see, you guys, you did it for you people.
Yes.
Not knowing the impact it had to other people out there. Yeah, because they keep on coming up to now.
Wow.
And they also keep on referring people. Yes, and even to some, just watching brings along some healing or some triggers for them to get to know, oh yeah, like the one we did for communication in marriage. Most people kept on coming and saying, I think I'm also suffering from this. I think I'm also going through this, So for you people to be our amazing clients, to decide that you are going to walk the journey with your people out there, and also now to come back and we be family.
Amazing.
Thank you. We do appreciate it.
Asante sana. I know that there's so much crisis happening in terms of like marriages and what have you. I remember the story that we were discussing that particular time.
Yes.
It wasn't necessarily about marriage, but it was about grief. But what I've come to discover, that it really even helped me personally to deal with it, to overcome with it, because I think that would be the worst thing that would happen to any child, is losing your mom. Like the worst thing that would happen to you as a child is to lose your mom. But I've seen this grief affecting marriages, not even one marriage, like different people I've seen. Now, even the people who are affected by grief, they don't even realize that it's actually the grief of someone they lost in their family that's directly now affecting how they are relating with their spouse. So I just want to thank you so much for like bringing this to light and making people also aware what is actually really happening even in our marriages, what's happening in terms of like what's happening internally na kusaidia watu.
Yeah, so I think, Trizah, we can jump into it.
Yes.
What happens in a therapy session? Because hiyo ni kitu watu wengi sana wanaweza taka kujua. What exactly happens in a therapy session? Probably watu wanafikirianga mnaendanga hapo kupigwa lecture.
People, they have different myths about what goes on. Some will come even with a list. I would like we fix this, after this we go to this. For this one, you're going to advise us, all those things. So they'll come with different expectations. But one thing, it's good to note, this is only done by professional people.
Okay.
Doesn't mean that when you go to your religious leader, Nyumba Kumi leader, or someone else, that what they do, it's not important, but it's not therapy. It's good to let them know whatever they go through, maybe some sort of now advice and the guidance, because for any professional counseling, there must be a professional psychologist. So that's a base to start from. So this means we've gone to school, we've gone through the training to be able now to come and deal with you. So let's talk of someone out there, they really do not know what goes on. And even for some people, they wonder, why would I keep on going 10, 20 times? But trust you me, this, first of all, it's part of self-care. Have heard you say you don't have to be unwell for you to go for therapy session. Just like even for ourselves as ladies, you don't have to feel like so bad or to have a headache for you to go and change your hair or something. It's part of self-care. Like, this is open for everyone, and everyone from the age of 4 years, not just for grown-ups. So that's number one. Then what goes on? What goes on, it's we evaluate your mental status. It's more of you come in with presenting issues. I'll give an example. You may come in and tell us, my marriage is in issues, or I'm having issues at work. Whatever, like you've said, kiatu inanifinya, it might be just anything, but not necessarily. We have people who will just walk in and say, have heard about therapy and have just decided to go for therapy. One, and you can remember this, our clinical intake is therapeutic. In fact, we give it a double session for our first session, because by the time you are going through that form, even if you just decided, have seen Allsmiles, you are here, have just decided, let me just come, I pay and I get to know what goes on. Trust you me, our intake is not just any formality or the forms, it's mental status evaluation. Why? Apart from getting to know your name, where you come from, the next thing, we start with you as a person. How do you define yourself? And guess what? So many people, they do not know how to define themselves. Rechi, when you are not Rechi, Pikana Rich, when you are not a mom, when you are not a content creator, when you are not a daughter, who exactly are you? That one alone, it's a question that sets people aback, and they start thinking, who am I? Because we start by dropping, all these things. Who are you exactly? If you must say I'm a psychologist, then who are you? What's your real identity? Without all these things that we've acquired, without you being a wife, who are you? At what point do we get to define ourselves? You see even what you are thinking. Now it all starts from there. Because most of us, we lost ourselves long time ago.
By being defined.
Yes, we allow things to define us. You people, you're already out there, public, limelight and all that. What people will wake up today and think of you, that's what now becomes of you. You've not had, I'm the Rechi who is being bullied, or I'm Kemu who people are saying about this. Like, you are there or you are mood, not necessarily you people. Everyone out there. It's about what other people, what have acquired and what have gained. Defining yourself, because we start with your name. Who exactly are you? That one alone, it's therapeutic. It now gives basis for therapy sessions, because we need to go back to when you could define yourself. I have a beautiful voice, my eyes, we lost ourselves. If I ask you, what color is your eye? Maybe you will ask for a mirror because you do not have time for yourself, and this is what I like. It's all about you. But as we start, I'm a mother, I'm a father, all those things that we've acquired along the way. I'm this professionally, I'm like this. That's one. Then again, we go back to share with us your upbringing. And with this, we only look for two things: the unpleasant memories and pleasant memories. One thing, unpleasant memories, of course, some things, they need no therapy. I went to school without shoes. You're clapping. That's an achievement. And you are here,
You're here with shoes.
Others, this is when people get to maybe take a minute and think about how they were abused when they were kids. Some things, they just happened, and in a way they were just covered, and maybe it's what manifests in our today, who we are, but unknowingly. And so when you are given a chance, because how often, I mean, you guys, you have friends, how often do you get to meet someone and they ask you, but hey, Kemo, share with me some of your unpleasant memories when you are growing up. Those are things that we don't do. How are you? What are you? You know, that's, it has become like our anthem. Those are the greetings.
Yeah.
But do we really get to know who is this Kemo? Even when people are meeting for dating, we always start with, tell me more about your past relationships. That's where now you want to assume this person started breathing from their past relationship. Or where did you go to high school? In fact, not even primary school, you know. But anything about how this person grew up, nothing. But when now you're given an opportunity, and one thing, when you talk about professional, remember, and it's good to let people know, of course, we always say, we have one therapist, many clients. We have one client, one therapist. The rule that we take is one client, one therapist. The time I'm with you, it's not about the client I'm seeing next, not the one I'm from seeing, it's me and you. One thing we don't walk into that room is, Trizah, I walk in as a professional psychologist. I have all the time for you, and that's why, you know, we don't have tables and all that, because I'm here, we are doing an entire evaluation. I'm able to tell, you know, some basic things, like you are talking with someone there. I don't know if you've ever had, even yourself, these are some of the things you can monitor. Yeah, when someone is anxious, they'll be like, you know, that one, yeah, some signs, we call them non-verbals. There is no way I'll come with being Trizah and I'm able to evaluate you. You know, yes, that's why it's done in a professional way. So now we start, let's go back. And let me tell you, most people, they break down during this time, unpleasant memories, because we are talking of things that happened to you. This is the time for someone to remember, by the way, and you know, people were abused. People were raped. I'm sure as we continue, we'll be sharing much more about this, but they were raped and they never got to know they were being abused. Why? They needed to know what is sex. The person they asked decided to show them practically. So as a kid, they took that. You know, I mean, we showed them how to tie their, or how to polish their shoes, how to put on their socks. So everything is experimental. Why? Because of course we don't talk about it with them. So we've allowed other people to come and fill in the void. So a lot of things. But now when you ask, it's when things start coming. Trust you me, we have people in their adulthood, they've come to realize, wait a minute, I think I was raped. I think I went through this abuse. We start processing. But you know what? Our conscious self is very different from our physical self. You may have maybe imagined, I'm just being shown this, or it's not abuse, but your conscious self has packed that. You find today there is a way you react to traumas that took place long time ago. Of course, we have the pleasant memories. One thing, people are so excited talking about this. From where I am, I'm able to evaluate. A good example, if your pleasant memory is when you could have chapos, that's okay, a good one. We all celebrated that. I mean, in Ghana, I think that time it was very expensive, or just something. But again, my most, cherished moment is when my mom would come on a Friday and we were there, or my dad, we were there waiting for them. To me as a therapist, I'm like, wait a minute. So here we are discussing of an absentee mom, absentee dad. It's something you cherish, because I mean, if you're seeing them each and every day, really, is it something to cherish when they are coming? But if it's when they are bringing you gifts, that's okay. So we are able now to start pinpointing. Of course, from there we go to something we call genogram. We just want to know your family history, your pattern. Let me tell you, when most people start talking about their marriage, they see themselves. Me and my partner. My partner and I and our kids, nothing more. When you come, there is a pattern. And maybe if you start looking back, you find, for some people, even the sister is not married. Even the other sister was married, they're back at home. Even the other brother is with the third wife. Even, are you seeing? Pattern. And some will come, they're not even in marriage, but we are able, we call it genogram. We go back to your family of origin. Define your family of origin. And not just saying mom, dad, we want to know. We also want to know the dads in the family, a lot of things. So you find even when you just walk in, we've been able to do not only your history taking per se, but we've been able to evaluate a lot of things. First, we are looking for childhood traumas, and we are also evaluating for possible family patterns that might be hindrance into who you are. So there is so much. You actually don't have to have a reason to come for therapy. Yeah,
that's amazing. You've said something very, I've never even thought about it. Like, who is me?
Yeah.
Who am I? Is it safe for me to say that's where the healing starts from?
Yes.
Defining who you are.
From the one you enter to that room, you start defining who exactly you are. And it might take even 6-10 sessions without getting to know. You remember that thing of find X?
Yes.
Now here we put it as find Rachel. Please, who are you?
Yeah.
And people will come with all sorts of who they are, and who they are has an identity on something else.
Yes.
Kemo the musician.
Yes.
Now we are Kamores the Dominions.
Yes.
We are this. But who exactly are you? Yeah.
Now that you've asked that question, I think I really want to know, who am I?
See?
Next session, Cindy.
Yeah,
Next
sure.
session, right? Who am I?
Yeah, who are you?
That's amazing.
Yeah.
So, there are people who think that therapy is for mad people. Therapy is for people who are going through issues. What can you tell such people?
Okay.
Yeah.
Those are the myths, and maybe brought by Western, and also how we were growing up. There is a public hospital, without mentioning names. People decided that the name of that hospital becomes an insult. Wewe umetoka kule, sijui watu wa kule wako militant,
Wewe rudi huko.
What exactly that
Ama
did?
tukupeleke huko.
Yes, ama huyu mtu ni mentor anafaa kue,
Kule.
What that did, it created stigma. Trust you me, today, the number of people we've even been able to refer there. Why? Because of now what you're asking. And some people, they're like, no, we just can't. Why? The stigma around it. So, is therapy for mad people? No. First of all, it's good I make it clear. From my school of thought, we do not have mad people. Mad people, those are people we've created. They are all imaginary people. The people we term as mad people. But then it's good to let people know they are going through a mental health issue. And there is help.
They are mentally ill.
They are mentally ill. Hakunanga mwenda wazimu. Rachel can tell you this, you can take it to bank. No one is mad. They can actually get help. Those people we refer to wenda wazimu wanaokota makaratasi na nini, those are delusionals and hallucinations. They will talk to themselves and they will even talk to people. And they are seeing people. It's true, but they see people. They'll see people. They will see things that you can see. They will hear things you can't hear. I mean, these things, they happen for real for them. Why? Because you are not in the same mental status with them.
They're in a different level.
They are in a different level. They first lost insight. Insight is what makes you whole. Insight, let me tell you, is what makes you be able to define yourself. These are people, they do not even know themselves.
So they lost themselves.
They are not there.
Yeah.
Have you ever maybe thought of yourself not being there? And we are not talking of you are dead. Quote unquote, I've had people talk about my brother is just a cabbage. What they refer to as useless. It's good to make it clear. We do not have mad people. Hakuna wenda wazimu. No, nothing. Of course, we have a lot of beliefs. And the beliefs, I will not say they are all imaginary. I really do not want people to come after me. But let me say professionally, we don't work under the rule of witchcraft. We do not work under the rule of possession, demonic possessions. We don't work under the rule of curses. All those things. Let me tell you, there is what we term as human error. Human error might be because of our different values. We have Muslims, we have Christians, we have different people with their beliefs, different beliefs and all that. Some people, they believe in curses, others in witchcraft. We've seen, even nowadays, we have religious brainwash and all that. There is a lot of things happening, And so this is what we term professionally as minimization. because I really do not want to deal with my mad dad, my mad mom, my mad brother, alirogwa. Do you see now the human error is amerogwa, bewitched, it's demonic, they have a curse, it's in their family. So you stop thinking this person need help. That's why I'm saying, first, there is no mad people.
Sharpless limit already.
Yeah.
How will you help someone who is bewitched?
Yeah.
Because the only help is also
Amerogwa.
to take them back kwa murogi.
Alafu mchawi apate alikufa.
Ama alikufa, you know, you've heard of that. Yeah. Alirogwa na akakufa. So, which other help are you looking for?
Yeah.
It's to minimize. But let me tell you, all those people, definitely we can never diagnose just by saying, but most people, they are schizophrenic. Schizophrenic is the most severe mental illness. Of course, we have others, severe in different dimensions, but in reference to what we term as mwentawazimu and all that, schizophrenic. And trust you me, we have so many schizophrenic people out here driving, like, you see, let's all imagine, because even me, when I was growing up, I can think of one, or even today, just think of that person, you know, si kuna mwenye nakuja sahi.
Wengi.
Now, kuna kama hao wengi who are operating, working in permanent employment, driving their vehicles, catering, yes, huyo mtu mwenye umeona, yes, why? It's, yes, schizophrenia, and of course we have different spectrums of schizophrenia. It's a long-term or a lifelong illness, but manageable. It's manageable. Medications, of course, first, if they're in that state, quota and all that, they need time to be rehabilitated and to be somewhere for medical treatment, to stable them, and also for them to start now regaining back the lost insight.
Can I ask a question?
Yes, please do.
By the time anafika point ya kuokota makaratasi, I'm presuming hakuamka akaanza kuokota.
Yes.
This is something that gradually got there.
Yes.
So is it safe to say that if you catch it early, it's better than just letting this person go on until now they reach a point of collecting the papers?
Oh yes, what we are saying, if they're already collecting the papers, there is help. That's not the end. Please, wacheni kuwafungia kwa manyumba. You know, stop saying huyu atachapa watu unamfungia. No. There is help for that. That's number one. However, that's why we are demystifying the saying that it's for mad people. If you are even out there, because let me tell you, Kemo, these people, and when they start, then you see them after, it's like you and me. You can't really tell who alikuwa naokota for all those years. So these people, they are just like you and me. It's even you. If you are the person we are talking to, when you start feeling overwhelmed, overwhelmed is you have so much thoughts. And of course, life gives us that. We have hardship, economy, a lot of things happening. But when you feel you are so stretched, please, there is a way to cope. One thing, that's why we say therapy is not about fixing. You will not come and we have a list of solutions. But we are here, how can we cope with the situation? It can be a situation like you are stuck in town, the much you need is fare to go back home. Are you seeing? But you are there stranded. So by that time, the solution you require is just bus fare. No matter how much I find you there and I'm busy doing therapy, clearly that will not take you to your place. It's how do we cope with this? Is it possible maybe you start walking slowly before it's late, you might get home? Is it possible? Is there anyone we can call? Are you seeing? So I'm just giving a layman example. So it's all about, even in the midst of the pain that I'm going through, how can I cope with this situation? Some people, they are committing suicide because of debts. Loans, right, left, and center. Ours, we will not come and we tell you, here is the money, go and pay. But how do we cope? What we do is, because all these life experiences, and life experiences is what make people go for therapy. At times they might be just overwhelming. I mean, I am relocating. We have people coming. I'm anxious, like I'll be out of the country for the first time. I do not know how will I go there, how will I maybe relate with people. You are starting your first job, you do not know. You're not coming for career coaching, you are coming for mental status evaluation. Like, always remember yourself. Yes, there is help for those people. And if you're their caregiver, get to know. People have stopped being each other's keeper, but get to know, Rachel nowadays, there is just something. And you know,
Off,
it
yeah.
starts with just as little as someone who is never used to shouting. All of a sudden they're shouting. We have a big difference between, of course we are talking about mental status evaluation. We have a very big difference between mental disorders and mental illnesses. It's good for people to know. You know, the way for physical illness, we have HIV and AIDS. You can have a disorder, but is it to a level that we can term it as illness? So what we do as Allsmiles, we have an assessment unit. They'll come, they'll assess you. You get to know where exactly. I'm telling you, like for the self-care, you might score a 0.
What?
Yeah, there is such possibility. You know, self-care is not about the acquired. Let me tell you something. We are pieces of what we've acquired along the way. That brings about the brokenness.
Yes.
You know, the moment you started now offloading who exactly you are, the authentic self, and you acquired, I'm a mom. I am not saying you're not all those things, by the way. You are, but who exactly are you?
Before anything.
Before anything that makes you, because now we are patches of a mom, a wife, a husband, in-law, you know, all those things, yeah? So now when you go for self-care, we really want to know. And you know, people will come with the holidays and all that, and you're like, okay, these are family affairs, these are church engagements, these are, you know, all that. So we have personality disorders. One thing I tell people, it's always good to learn about, first we do a personality test.
Yes.
Everyone has a personality test. And now there is what we learned in school, and most of the time we are busy diagnosing ourselves with that. When now we come, we really want to match that with a disorder. Like if today you are now to flip into a disorder, where would you be? And that's why we have some people who are in perfectionism. To them, if they want things to be like this, and if you ask them, it's not about them, it's other people. This person is not doing this. This one is not doing. They'll always be angry because people are not doing things the right way and wondering how comes. But the moment you create that awareness, by the way, it's not about other people. It's you who want to see things streamlined. You know, in the house, there is a way they want their clothes, their slippers, everything. When they just wake up, we have maybe cups there. To them, it's about their mind, and they feel now they are disoriented. They are not able to operate. Yeah, no, I'm saying now we term them as traits if it doesn't meet the threshold. It's a trait that you carry. It's always good to get to know. Some people, they want to keep. They are keepers. You know how the art of hoarding, like you just want to have anything that you want. I don't know what you are given, 1993, 2000, you know, you have things you do not want. You do not want to throw them away. At time you get to know, by the way, this could be a trait. It's not that I am so passionate about this. It's not that I have great affection with attachment that I was given by so and so. It's just a trait. You know, we have different traits. Do you know we have people who can trust? Have you ever had people, and they even the eyes they are giving you, like whatever you are telling them,
They won't trust you.
they will not trust you. You even bring and you tell them this is chips. Okay. Like they get to know, by the way, it's not about other people that I don't trust. It's my trait. It creates that awareness. So yes, back to that, we do assessment. We have some assessment that they are must. Personality traits, about self-care, to get to know who are you and do you really take care of yourself. And even ourselves, we do that most of the time, and you realize, oh my goodness, I am more into others, into helping, and not about me. The art of self-care as an assessment. Now from there, of course, after the first you've gone through, let's say what I was referring to, maybe childhood experiences. Now your psychologist will now have referred some diagnosis to be done on you, just to assess, might you be having any traces of childhood traumas? Again, someone might be talking, like in our case, chemo, about the loss and grief. The fact that you've lost a loved one really doesn't mean that you never processed. Some people, maybe they've been able to heal along the way. So it's just to check, how did you process this? How are you? Do you have, we look at the impairment. Do you have any impairment in your today's life affected by your life experiences? That's why assessment, it's always our third or our fourth session. It's very, very important. Why? It's in this state we get now to get to know those people who have schizophrenic spectrum, autism, for kids, ADHD, and even for grown-ups, by the way. You know, people do not know even you are a grown person, you can still be diagnosed with autism. Yes, and a lot of things for personality. We even have severe ones. So now what happens after the assessment, if in a way now it's within the range of being a disorder, we now refer to a psychiatrist within. We have one. Now for psychiatric care, it's now for medical evaluation. First to get to know, do we even have insight? Because we might have talk therapy all through, and all of a sudden that person is asking, where is my mango? And we are wondering, mango. Are you still here? Yes, because they came and dropped me and left. And you can't comprehend. We have most of that. Like literally nothing much. You can't process anything.
Oh, really?
Because the next thing they are asking, where is my baby? You're the one to remind them, by the way, you've not given birth. We are here. They'll call you their grandmother. You know those things.
They're just disconnected.
No, there is no insight. You know, when they now that's what I'm terming is being able, the art of comprehending. You see the things we take for granted. Being able to think and like you are okay, coherently. You can comprehend, make a statement. We think it's just a normal thing. Trust you me, we should be thankful just for that. That I can wake up and request for a cup of tea. Someone will just wake up and ask, when are we landing? Ask the pilot to stop. But you've just woken up. They just can't. It's the insight. So in such cases, and of course we are not saying, by the way, we are not saying if you've been referred for psychiatric care that you've not been able to comprehend, no. But we are saying after the assessment, they've been able to see something. And felt it's, because now it's within the ranges. We have maybe from 0 to 10 or 1 to 100. And they know if you're below this or if you're above this. So we normally have, this is within the normal range, but we've said no one is normal. So the normal is the normal to the abnormal, Then of course we have the moderate. Moderate is, yes, we have something, but let's process through the therapy. I mean, you are in grief. You're not expecting your scores to be like someone who has just come in from honeymoon, you know those. Then we also now have the severe. Severe, you go now to our psychiatrist. So our psychiatrist, she comes in on Thursdays. So we have them, and there are several. So we have it on Mondays and Thursdays. So you come, they evaluate you medically. This is the time now you're even prescribed for medication if you are needed to be stable. So have talked about schizophrenia spectrum, we have bipolar spectrum, we have autism, we have a lot. We have so many, even we have some insomnia, but we really want to know it's insomnia as a result of what. We have major depressive disorders. This is the time everything is now, if it's present, you are now seen in what we term as multidisciplinary team. We have psychiatric care, we have psychometrician, we have psychologists. Then after that you come back to us and now we process. So that's entirely what happens in a therapy session. It's not storytelling. Do we have moments we just come and you keep quiet? Yes. We have moments we will just get in and we start with here and now. When a client comes and you evaluate, client doesn't want to talk. It's your session. I'll be here. I'll only let you know I am here for you and I'm here to walk the journey with you. I will not be on my phone because you're not talking. I will not keep on getting out. In fact, I'll just be here. I am looking at you. And it's okay. I'm looking at you, and I'm not actually distracting myself. I'm just here for you. And to some people, that's still therapeutic. And we normally have that within the first sessions, where they just feel, I just want to be here. That's why you see our rooms like this. Do we get tears? We love tears. We love tears. That's the beginning of healing. You know, for some, they'll just come, and that's why we have boxes of serviettes all over. They'll just come and break down. When you're breaking down in a therapy session, you're already getting somewhere. We have verbal, non-verbal. To me, that's non-verbal therapy taking place. Silence is still non-verbal therapy taking place. For silence, it means this person is so much enmeshed in their emotional jail that even trying to just climb up and share and open, it's so hard because they are so deep and they just want to come and be there. Patience over time, maybe even in our fourth, fifth, that's when now they'll be able to say a word, and we will start from there. But trust you me, it offers healing. Yeah, so that's the entire process. Now you see where we get to know about, quote unquote, the mad people, and we've said, with that now, do you agree with me? We do not have mad people.
We do not have. I think, Trizah, right now where we are, there's a lot of mental disorders going around, depression. People actually don't even know if they're suffering from depression or not. But you realize that people are actually interested in knowing, am I really depressed? And I think this is some of the topics that I'd really want us to talk about in the future. So that people will understand where they stand. So there are people who misuse the name depression.
I know.
Manze mimi niko depressed. So I want us I think as we go on, we are going to talk about depression, mental disorder, bipolar. I always say kuna watu wanakuwa na bipolar wanafikiria wako depressed. I don't know if it's right for me to say that. Mtu ako na bipolar na ajui hata ako na bipolar. So I think, guys, we are about to come to the end of our session today, and thank you so much for taking us through this, for even helping these people out there, the ones who have come here for therapy. I am so sure in one way or another, mali wako wanasemanga kama si Allsmiles Therapy ningekuwa mali pabaya sana. So thank you so much. And also to our viewers, let me tell you, you need therapy. Even if you think you don't need it, you actually need it. You know, even if she has said it, hata kama ni ukuje ukayapa akaipale muangaliane kama picha, you need therapy, right?
You'll be amazed as to how much.
Yes, you'll be amazed as to how much you really needed to unpack and all that. If you're out there, you actually need therapy, and these are the contacts to Allsmiles Therapy Center. Just call, just come and unpack everything that you have to unpack. And also, I can't forget that we also have a rehab. If you're out there, you have someone that you feel or you think needs rehabilitation here at Allsmiles Therapy, we will give you that service. Trizah, parting shot.
Thank you, Pikanarich. Thank you, Kemo. You know, thank you. As you've said, they've achieved healing, and they've come saying, thanks to Pikanarich, I watched, I got to know there is help, and I came for this. So we do appreciate you. We are here to walk the journey with you. And yes, for addiction, any mental disorder or mental illness, we have a rehabilitation center to ensure that we are there for your people and who need this more, because I'm sure as we go on, we'll still be talking about addiction, which is on the rising, you know. So thank you, and thank you so much for hosting me.
You're welcome. So guys, we are going to have more of these sessions. Thank you so much for watching. This is Mental Fitness with the Kamores. See you next time.